Welcome to the Dental Pro Tech Talk, the ultimate show for dental professionals staying on the cutting edge of dentistry and technology. Join us as we explore the latest advancements from soft tissue diode lasers and teeth whitening to imaging breakthroughs and beyond. We're here to help you future-proof your practice and deliver exceptional patient care. Whether you're a dentist or hygienist, this podcast is your go-to resource for tips, growth, and all things tech.
Welcome back to Dental Pro Tech Talk. Today we are taking a deep dive into something that's super important if you're a dental professional working with lasers, and that is fiber optic tips.
Yeah, we are going to be breaking down a webinar by Dr. John Graeber called Clinical Tips on Tips, and he shares a lot of really practical knowledge on how to get the most out of diode lasers.
And he should know.
He does. He has over 30 years of experience in this field.
Wow.
He was even the president of the Academy of Laser Dentistry.
That is amazing.
Yeah, so we're talking real insider tips here from somebody who has been there and done that.
Absolutely. So we're all about efficiency and safety and, of course, those amazing clinical results. But let's start with the basics.
Right.
How does that laser light even get from the box to the tissue?
Well, that's where fiber optic cables come in.
Okay.
Imagine them like these teeny tiny little pipelines for light energy or photons. And these cables have a core where the light actually travels and it's surrounded by a cladding. And that acts like insulation to keep those photons contained until they reach the very tip of the fiber.
So kind of like an electrical wire with insulation to prevent shocks.
Exactly. That's the idea.
Okay.
And this is really important for dentists because we're so used to tools that cut on the sides, right?
Right, like a bird.
Like a bird.
Yeah.
But with most laser tips, the action only happens at the tip.
Interesting.
Those photons only come out there.
Oh, that's a big shift in thinking. You're not using the sides at all.
Exactly.
Wow.
It's all about precision.
Interesting.
Getting that laser energy right where you want it.
Okay.
Now, before we go any further, it's important to know that there are two main types of laser tip systems.
Okay.
You have disposable and trunk fiber.
What's the difference? And more importantly, which one should we choose?
So with disposable tips, each one is a self-contained unit.
Okay.
You use it and then you toss it.
Right.
So it's super convenient.
Got it.
You don't have to worry about cross-contamination, but they can get a little pricey over time.
Mm-hmm.
Now, with the trunk fiber systems, they use a single reusable fiber
Okay.
that runs from the laser all the way to the handpiece.
Got it.
And after each use, you just cleave off a section of the fiber.
So it's like choosing between those disposable razors versus the ones with replaceable blades.
Exactly.
Right.
Perfect analogy.
Yeah.
So disposable tips are like those convenient razors. The trunk systems are more like the ones where you just replace the blade.
Makes sense.
So the trunk systems are more economical in the long run,
Right.
but they require that extra step of cleaving the fiber.
Okay. So it really just depends
It does.
on your practice needs.
It does.
And budget.
And budget.
All right. Let's talk more about those disposable tips.
All right.
Because I understand they're not all created equal.
You are right.
So tell me more.
Disposable tips come in different lengths and thicknesses, and those variations can have a huge impact on how you actually use them.
Okay.
So for instance, you've got the 5mm tips and the 9mm tips.
Okay.
Those shorter 5mm ones are going to be more stiff,
Okay.
giving you more control for things like surgical procedures.
So like if I'm doing a biopsy and I want something really precise, that shorter tip is going to be better.
Exactly.
Yeah.
Think about it like choosing a fine tip pen
Okay.
for really detailed drawing
Yes.
versus like a thick marker.
Right. Yeah. Yeah.
Now, on the other hand, those longer 9mm tips,
Yeah.
those are more flexible,
Okay.
which is essential when you're trying to reach deeper areas,
Okay.
like periodontal pockets or root canals.
So the tip length is really about accessibility
Yes.
and control
Yes.
for the different procedures you're doing.
Yes, precisely.
Okay.
Then there's fiber diameter,
Okay.
and these typically range from 200 to 400 microns.
Okay.
The smaller the diameter, the more flexible the fiber is going to be.
Okay.
But here's the catch. The smaller diameter also means you have a more intense laser beam.
Wait, so a smaller tip delivers a stronger beam at the same power setting.
Exactly. It all comes down to power density. That's the amount of laser energy concentrated in a given area.
Got it.
Think about shining a flashlight on a wall. The beam is more intense when it's closer, right?
Right, because the light is more focused.
Because the light is concentrated in a smaller area.
Yeah.
Same principle applies to the laser fibers.
Interesting.
The smaller diameter concentrates that energy, making the beam more intense.
So that is really important to remember.
Yes.
Two lasers could be set to the same wattage,
Right.
but if one has a smaller fiber tip,
It's going to be more powerful.
It is delivering that more focused energy.
Yeah.
Okay, so choosing the right power setting is really important then.
Yes, it's critical.
Yeah.
And you need to adjust for the different procedures that you're doing.
Right.
And definitely adjust if you're switching between different fiber diameters.
Yeah.
You don't want to accidentally apply too much energy just because you switch to a smaller tip.
Right.
That would be bad.
That's a good point. It seems like there's a real art to mastering those laser power settings.
There is.
Right.
And it's not just about the setting itself.
Okay.
The power density is also going to change as you move the fiber away from whatever tissue you're working on.
Oh, interesting.
So the further away the tip is, the less intense the beam is.
It's almost like a dance between the tip, the power setting, and the tissue.
Yeah, it is a dance.
Yeah.
Yeah.
It seems like getting that feel for how it all works is key.
Yes.
Now, Dr. Graeber also seemed to stress having a clean, flat tip surface.
Yes.
Why is that so important?
He's right to emphasize that.
Okay.
A flat tip surface is really crucial for efficient photon delivery.
So it's about making sure those photons are coming out in a straight line.
When the tip is flat, those photons exit in a nice, straight, organized line.
Yeah.
It's called a columnated beam.
Okay.
If the tip is damaged or uneven,
Yeah.
you don't get that nice straight beam.
Okay.
The photons scatter,
Right.
which makes the laser less effective.
So it's like shining a flashlight with a cracked lens.
Exactly.
The light just kind of goes everywhere.
It scatters and weakens.
Yeah.
And that's the same thing that happens with the laser.
That's interesting.
If the tip is not flat,
Okay.
you want those photons all marching out in formation,
All right.
not scattering all over the place.
So how do we check if the tip is flat and ready to go?
Your aiming beam
Okay.
is your best friend here.
Okay.
It's going to show you any irregularities
Got it.
that might be scattering the laser beam.
Okay.
And while we're on this topic, let's bust a myth about tip initiation.
Okay.
You do not want to burn the sides of the fiber.
Why is that?
I've heard people talking about doing that.
Yeah.
It just wastes energy.
Okay.
And you can actually damage the cladding,
Oh, right.
that protective layer we talked about earlier.
Yeah.
It's all about focusing that energy right at the tip.
Okay.
Dr. Graeber recommends a simple technique.
Okay.
Using dark blue articulating paper.
Okay.
Put it on a white surface. Hold the fiber tip against it and fire the laser once, just enough to transfer some of that ink to the tip.
Okay.
And that's it.
That's it.
No need to try and melt the sides or anything like that.
No melting the sides. And whatever you do,
Yeah.
do not use Mylar articulating paper.
Why?
It's a fire hazard.
Oh, wow. Okay.
Literally.
Okay, good to know.
We want to be safe out there.
All right, so we've covered those disposable tips.
We have.
Let's talk about cleaving trunk fibers. That sounds a little intimidating.
It's not as scary as it sounds.
Okay.
Once you get the hang of it.
Okay.
But you're right. There's definitely a technique to it.
Okay.
Dr. Graeber calls it the silent scratch.
What is the silent scratch?
So when you're cleaving a fiber,
Yeah.
you're scoring it with a special tool
Okay.
to create a clean break.
Okay.
The key is to do it gently.
Okay.
You apply just enough pressure to create a faint scratch.
If you hear a snapping sound,
Yeah.
you've probably used too much force and damaged the fiber.
So it's all about finesse, not brute force.
Exactly.
Okay.
It's all about getting a feel for the right amount of pressure.
Yeah.
Once you've made that silent scratch,
Okay.
you can then snap the fiber cleanly,
Okay.
creating a fresh, flat tip ready to go for your next patient.
Yeah, and speaking of getting a feel for things,
Yes.
Dr. Graeber also emphasized inserting the fiber into the handpiece carefully.
Yes.
You don't want to crush it with the collet.
No.
So it's about finding that sweet spot. Secure, but not too tight.
You got it.
Okay.
And here's a handy tip.
Okay.
Before you thread the fiber through, make sure you straighten out the cannula.
Okay.
That's going to help prevent breakage.
Good tip.
Yeah.
Now let's talk about actually using the laser to make incisions.
All right.
This is where it gets real.
It does.
So making those precise incisions with a laser fiber tip is all about technique.
It is.
So we want to hold the tip slightly off, perpendicular to the tissue,
You do.
and use pulling strokes
Cooling strokes.
rather than pushing.
Yes. Why is that? I feel like pushing would be more intuitive,
Right.
but pulling strokes give you more control,
Okay.
and they prevent the tip from getting stuck in the tissue.
Okay.
It's a much smoother glide
All right.
rather than a forceful push.
So it's almost like using a scalpel with a really delicate, controlled pull.
Exactly.
Okay.
And hand speed also comes into play here.
Okay.
If you're a slower, more deliberate operator,
Yeah.
you can use lower power settings.
Yeah.
If you tend to move quickly,
Yeah.
you're going to need to adjust accordingly.
So it's that dance again, that
What's the
balance
dance?
between your hand speed, the power and the tissue type.
You got it.
Okay.
Dr. Graeber also made a really important distinction between excising tissue
Oh.
and ablating it.
Can you break that down for us?
Yeah, so excising means you're cutting the tissue out completely,
Wow.
while ablating means you're kind of vaporizing it with the laser.
Okay.
And a lot of times, excising is going to be more efficient,
Okay.
especially if you can put the tissue under tension.
So it's knowing when to cut
Yes.
and when to vaporize.
Exactly.
And when you are excising, that tension really helps
It does.
to create a cleaner cut
Yes.
with less bleeding.
Yeah.
Okay, so let's talk about what that ideal incision should look like.
Okay.
What are we aiming for?
You want minimal charring,
Okay.
a zone of coagulation where the blood vessels are sealed,
Okay.
and limited thermal damage to the surrounding tissue.
So it really all comes back to precision.
It does.
And control.
It does.
This is all making a lot more sense now.
Good.
I am curious about power considerations.
Okay.
It seems like choosing the right power setting is critical,
It is.
but also potentially tricky.
It can be.
So tell me about that.
Okay, you're hitting on a major point that Dr. Graeber kept coming back to.
Okay.
Use the lowest possible power setting to achieve your outcome.
So don't just crank up the power and blast away.
No, definitely not.
Yeah.
Cranking up the power past 1.5 watts doesn't make things go faster,
Okay.
and it can actually harm the patient.
Got it.
It's about working smarter, not harder,
Right.
and finding that sweet spot
Right.
where you're effectively treating the tissue
Yeah.
without causing unnecessary damage.
So much more nuanced than I initially realized.
It is.
What about different tissue types?
Okay,
Do those require different power settings?
absolutely.
Okay.
Different tissues respond differently to laser energy.
Right.
For example, granulation tissue,
Yeah.
which is rich in blood vessels,
Yeah.
can be cut at lower power settings,
Okay.
around 0.5 watts.
Got it.
But loose connective tissue might need a bit more,
Okay.
maybe 0.7, 0.8 watts.
So you need to adjust based on what you're working with.
You do.
Makes sense.
And even with denser, more fibrous tissues,
Yeah.
you rarely need to go beyond 1.5 watts.
Got it.
Dr. Graeber really stressed that in the webinar.
Okay.
It's all about understanding those subtle differences
Right.
and adjusting your technique accordingly.
That makes sense. So we've talked about power
We have.
and technique.
Yes.
What about maintenance?
Okay.
I imagine keeping those fibers and connectors clean is really crucial.
It's absolutely essential.
Okay.
You want to avoid getting any finger oils or dust on those connectors
Okay.
because that can actually interfere with laser transmission.
Oh, wow.
Dr. Graeber showed some pretty scary pictures of damaged connectors in the webinar.
Okay.
Trust me, those repairs can get really expensive.
Yeah, I bet.
So it's worth the time
Right.
to keep those connectors clean and handle them with care.
Okay. What about managing blood and debris during procedures?
Yeah.
Does that impact the laser's effectiveness?
Absolutely.
How so?
Blood can coagulate on the tip,
Okay.
especially when you're working at inflamed tissue,
Okay.
and that blocks the laser energy from reaching the target.
So it's like trying to shine a light through a dirty window.
Perfect analogy.
Yeah.
It's why you need to regularly check and clean the tip during procedures,
Okay.
especially if you're seeing a lot of bleeding.
Okay.
You might even need to reinitiate the fiber
Right.
if it gets too clogged with debris.
So cleanliness is key.
It is key.
Okay. What about those times when you need to get into those hard to reach areas?
Yeah.
Can you bend the cannulas?
You can pre-bend those clear disposable cannulas
Okay.
to improve access,
Okay.
but you have to be really careful not to kink them
Wait.
or damage the fiber that's inside.
Right.
And whatever you do,
Yeah.
don't try to bend metal cannulas with your fingers.
Why is that?
Bending metal cannulas by hand can create weak points.
Yeah.
And then they are more prone to breakage.
Okay.
It's much safer to use a specialized bending tool.
Got it. So use the right tool for the job.
Exactly. You don't want to strip those threads.
So speaking of breakage, what are some of the most common ways that these laser tips get damaged?
Dr. Graeber shared some cautionary tales in the webinar.
Oh, I bet.
A lot of them boil down to just simple carelessness,
Okay.
dropping the tip on the floor,
Yeah.
pushing it too forcefully into the tissue,
Okay.
using the sides of the fiber for cutting.
Right.
All things that can be avoided with proper technique and attention to detail.
So it's about being mindful
Yes,
and respecting that these instruments are delicate.
exactly.
And of course, using too much power can burn
Yeah,
and damage the tip.
it can.
So again, working smarter, not harder.
Yes,
Okay, we've covered a lot of ground here.
we have.
We've talked about different types of tips.
Yes.
How to prep and use them safely.
Yes.
And even those common pitfalls to avoid.
Right.
I'm already feeling like a more informed laser user.
Good.
What else did Dr. Graeber cover in the webinar?
He touched on a few other important points,
Yeah.
including the different laser models available on the market.
Oh, like what? I'm always curious about the latest tech.
He mentioned the Pioneer,
Okay.
the Pioneer Elite,
Okay.
the Picasso,
Okay.
and the Monet Curing Light.
Oh, cool. Okay.
And each model has its own features and benefits.
Yeah, for sure.
So it's about choosing one that aligns with your needs for your practice.
Absolutely. That makes sense.
Yeah.
What about reusing and re-sterilizing tips?
Okay.
Are there any tricks to extending their lifespan?
All right, here's the hard truth.
Okay.
Disposable tips cannot be re-sterilized.
Okay.
The cladding will melt,
Oh, wow.
which makes them useless.
Okay.
So once you've used a disposable tip,
Yeah.
it's time to say goodbye.
Got it.
No cutting corners there.
Okay. No trying to be thrifty with those.
Right.
But are there times when you can reuse a tip?
Yes. If you're performing multiple procedures
Okay.
on the same patient
Okay.
during a single appointment,
Yeah.
you can reuse the same tip. Just make sure you're keeping it clean
Okay.
and protected between uses.
All right. That's good to know.
Yeah.
Anything else about reusing tips?
You can also re-cleave a disposable tip if you need to create a fresh cutting surface.
Got it.
But again, only for the same patient
Right.
during the same appointment.
Okay. So what about those attachments I've seen for therapy and whitening?
Oh, yeah, those attachments are like add-ons
Okay.
that modify the laser beam
Okay.
for different applications. They can be really helpful
Yeah.
to expand your laser's capabilities.
Sounds useful.
They are.
Any caveats we should know about?
Just remember,
Okay.
attachments change the power density of the beam.
Oh.
So
yeah.
you're going to need to adjust your settings accordingly.
All right. It's like adding a new lens to a camera.
Exactly.
You need to kind of recalibrate
You do.
to get the best results.
You do.
Okay. So we've covered a lot of ground here.
We have.
We've learned about different types of tips,
We have.
how to prepare and use them safely,
Yes.
and even those common pitfalls to avoid.
Yeah.
I'm already feeling like a more informed laser user.
Good. You know, I'm still thinking about all those incredible insights we got from Dr. Graeber's webinar.
Me too. It was like a masterclass in laser dentistry.
It really was.
And I think it really shows just how passionate Dr. Graeber is about this technology.
Yeah.
And how much he wants to share that knowledge with others.
You know, one thing that really stuck with me
Yeah.
was his story about the first time he used a laser for a gingivectomy.
Oh, yeah.
He said he went in a little nervous at first,
I can imagine.
but then he said it was like a light bulb went off in his head.
Wow.
He just realized how precise and controllable the instrument was.
And he has been practicing for 50 years. He called it the most precise instrument he had ever held.
That's incredible. It really shows how much this technology can change things.
It really does.
It's not just about replacing old tools, it's about opening up all these new possibilities in dentistry.
I agree, and it's about changing our mindset, too.
Right.
Remember that analogy of the tooth carpenter becoming a tissue sculptor?
Yes.
It's not just about taking something away or fixing something. It's about shaping and restoring tissues with such a high level of precision and artistry that we couldn't even imagine before.
I love that analogy.
It's so powerful, and I think it's something that both dentists and patients can really connect with.
I agree.
So to all of our listeners who are thinking about bringing lasers into their practice,
Yeah.
I say go for it. Explore those possibilities, get the right training, and really embrace this new way of thinking.
There are so many great resources out there to help you get started.
Like what?
Well, like the Academy of Laser Dentistry.
Oh, yeah.
They offer courses, workshops, they even have a certification program.
That's amazing.
Yeah, and don't be afraid to reach out to other laser dentists, share experiences and learn from each other.
Right.
There's this whole community of people out there who are so passionate about this,
I bet.
and they're excited to help you on your laser journey.
I love that. It's all about that continuous learning and growth.
It is.
And who knows, maybe you'll discover a whole new passion within your practice.
You might.
Well, as we wrap up this deep dive, I want to leave our listeners with one final takeaway that I just keep thinking about.
Okay.
It's the idea that lasers aren't just about technology.
Okay.
They're about making that human connection in dentistry even stronger.
That's beautiful.
When they're used correctly, with skill and compassion, lasers can help us create a more comfortable and positive experience for our patients.
I agree. They allow us to work more gently,
Yeah.
more efficiently.
And that can reduce anxiety, build trust.
Exactly.
And at the end of the day, isn't that what it's all about?
It is.
Creating that strong patient-dentist relationship based on mutual respect, understanding, and that shared commitment to optimal oral health.
You said it perfectly. It's a reminder that technology is only as good as the people who are using it.
So well said. To all of our listeners out there who are working so hard to provide the best possible care for their patients, I encourage you to explore the world of lasers, be open-minded, and remember that compassion.
The possibilities are endless.
They are.
And with that, I think we've reached the end of our deep dive into laser fiber optic tips.
This has been fantastic.
I hope you enjoyed it.
I have. I've learned so much.
I'm glad.
I'm sure our listeners have too.
Me too.
We'll see you next time for another exciting deep dive into the world of dentistry. Until then, keep learning, keep growing, and keep shining.
That's a wrap.